Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. So glad that you could join us today. Our guest is returning to talk with us about, well, sometimes a little known condition known as dystonia. She's Janet Hieshetter, Executive Director of the Dystonia Medical Research Foundation. She's returning to talk about some of the symptoms and proper diagnosis of cervical dystonia. Welcome to the program, Janet.
Thank you.
Thanks so much for returning to talk with us about dystonia. For our listeners who weren't with us before, when you were here before, tell us what dystonia is.
Sure. So dystonia is a neurological movement disorder that results in abnormal muscle movements and resulting in fixed postures, position, tremors, those kinds of things. Essentially, it's a loss of control of voluntary muscles affecting either the entire body, or it can be focused on one particular area like the eyes and blepharospasm, or the neck in cervical dystonia.
Are there different types of dystonia?
There are. So there's a generalized form that typically presents in children ages 8 to 15, and then there are what we call focal dystonias that will concentrate on and affect one area of the one area of the body, like the eyelids. Your eyesight is good, but your muscles are forcing your eyelids to be closed, so you're essentially legally blind. Or in cervical dystonia, where you're not able to control your head movements, it's being pulled to one side or the other.
Now, do these symptoms present equally in men and women and children, or are they more prevalent in one or the other gender or age group?
There's a slight more prevalence in women with the focal dystonias like in cervical dystonia, but in children it affects both girls and boys equally.
You know, when we were here before, we talked about some of the results of a recent survey that your foundation, DMRF, and Allergan Incorporated conducted that is attempting to raise awareness about dystonia. You got some results and found out what consumers knew or didn't know about dystonia, and a certain treatment that Allergan has got approval for. Could you talk about this treatment for dystonia?
Sure. So cervical dystonia is one of the approved treatments by the Food and Drug Administration for botulinum toxin, Botox, which I think most people associate with cosmetic use, but really it was approved by the FDA first for therapeutic use in situations like cervical dystonia. So a physician injects specific muscles, and those muscles are then temporarily weakened to lessen the effect of the muscle pulling. So in the case of cervical dystonia, they're injecting the muscles around the neck, and people are then given relief. Cervical dystonia can be incredibly painful, and in addition, just your head pulling to one side or the other can be disabling as well. So Botox really helps to provide relief for that, and it lasts generally from anywhere from 12 to 14 weeks. So the injections need to be repeated on a regular basis. And it's, for many people, it has been the gold standard in treatment, providing them quality of life. In many cases, people are actually able to resume going back to work, those kinds of things. So it's been really a godsend for many, many people.
Why do you think there's such a lack of awareness about dystonia?
Well, I think we live in an age where we're just constantly bombarded with information and news, and if you don't know anyone who's been affected by dystonia, it just sort of falls off your radar screen. I think it's not uncommon for people to hear the word for the first time when they get a diagnosis. So they're relieved to have a diagnosis because in many cases it may be 3 to 5 years before they actually get one. But then they're presented with this, sort of challenge of what is this? And when nobody knows what it is, when you receive a diagnosis of multiple sclerosis or a cancer, people have generally, other people in the community have a sense of what that is. when you're debilitated and living in pain, and you tell people that you have cervical dystonia, and they look at you and they have no idea what it is, it sort of it compounds the, the frustration I think that people who are affected with it feel.
Now, Allergan Incorporated got approved to use Botox as a treatment for dystonia. Other than the survey in an attempt to raise awareness and gain valuable information, what other activities have you collaborated with Allergan on in order to raise awareness about dystonia?
Well, we've actually worked with Allergan now for more than 20 years. They have had the approval actually for about that amount of time. Okay. So they were the first out in having Botox approved for both blepharospasm, the dystonia in the eyelids, and cervical dystonia. And from the very beginning, they recognized the importance of raising awareness of these disorders, not only to help reach people who might be suffering from this and not aware of it, but also helping those who had already been diagnosed and were having treatment for the reasons that we've just talked about, helping everybody understand what it is. And we've worked together in promoting people telling their own stories. We had a program called Dystonia Moves Me, where people share their personal story just in their community. They might tell their favorite bank teller or grocery clerk that the reason that their head is pulling to one side is because they have this thing called cervical dystonia, with the hope that when that person hears the word dystonia down the road, they'll say, oh, wait a minute, I know somebody who has that, and actually maybe create some deeper awareness. Allergan has also partnered with the DMRF to do community-wide awareness events. We have a series of zoo walks that have taken place around the country and have generated hundreds of thousands of media impressions to help people understand not only what dystonia is, but also how it affects lives, and that it's something that can be treated.
Let's talk about how it affects lives. You talked about it being sometimes extremely painful, debilitating disease, affecting, getting a haircut or going to the dentist. When it comes to, I guess, the psychological impact of having this disorder, talk about how important it is to seek proper treatment because of the lifestyle changes.
Sure. It's a great question. So people who have cervical dystonia are often isolated, and so it's important for them to know that they're not alone in this process. And I think our awareness activities have been helpful in doing that kind of outreach to connect them to other people. But also they're very self-conscious about their looks, so they tend to be not as eager to engage socially and to go out with family and friends as they might have before. There's a high incidence of depression with people who have cervical dystonia. So it really affects a person in all aspects of their life. Many, because of the severity of their cervical dystonia and the pain, and the fact that they don't have the mobility with their head, may have to go on disability. So they're having to give up their profession, the careers that they've worked, long and hard to achieve. And that, when you reach a certain point, your career is a part of your identity. So you've lost a part of yourself because of this cervical dystonia that people don't know about. They don't know what it is. And so it just really can snowball into a lot of frustration on many levels.
And where can our listeners go and get some more information about dystonia?
Well, they can certainly contact the DMRF's website, www.dystonia-foundation.org, or call our offices at 1-800-377-3978. And I would encourage them also to talk to their physicians. I think that's important too. If they think that if themselves or a family member may have cervical dystonia, we always encourage them to talk with their physicians or seek out a thorough workup from a movement disorder neurologist.
Well, it's been great talking with you today, Janet.
Thank you very much for the time.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Janet Hieshetter, the Executive Director of the Dystonia Medical Research Foundation, or DMRF. And she's been with us discussing some of the symptoms and proper diagnosis of cervical dystonia, and also the ways in which it affects a person's life on more than a physical level. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.